Well, the last roundup, the Total Efficiency Accountability Management System. You guys couldn't have come up with a better name. You got a great program. It's out of the city of New York, and Bernard Carrick and Deborah Kurtz are here. Thank you.
Good afternoon. On August 20th this year, I was appointed the 40th Police Commissioner for the city of New York. Prior to that, I was the New York City Correction Commissioner responsible for the largest municipal jail system in the country. With 125,000 inmate admissions, we controlled 16 jails, 10 of which were on Rikers Island. Most feel that Rikers is the largest penal system, penal colony in the world. We had 16 court holding pens, 3 hospital prison wards, 1,700 inmates to court, to and from court each day. We produce and we prepare daily 60,000 meals. In the mid-'80s, early 1990s, New York City jails, the system had the same reputation of New York City, probably being the most violent criminal activity on the streets in the system. And as a result of population growth and overcrowding, it led to a system of mismanagement and a severe lack of accountability. Stabbings and slashings in the system averaged at more than 100 per month. Over time, spiraled toward $100 million a year. Sick abuse, on average, ranged around 21 days per year per officer. Inmates waited 3 to 6 hours in the clinic for health care. Sanitary conditions were horrible. The infrastructure was failing, and morale amongst uniformed staff was virtually non-existent. For those that are familiar with New York City, the headlines constantly referred to gangs roaming and controlling the halls of Rikers Island. According to the New York press and media, in 1994, Rikers was about to explode. In that year, Rudolph Giuliani was elected mayor and mandated a change in the system. And by 1996, a program of total accountability and efficiency was developed by the New York City Department of Correction called TEAMS. TEAMS stands for Total Efficiency and Accountability Management System. The underlying principles of TEAMS is that the performance of each area of the department affects how the department performs its overall mission. To accomplish this, we had to articulate the department's goals and objectives. For those familiar with the principles and theories on reinventing government, you may be familiar with the term, what gets measured gets done. And we did that, and we had to identify and create specific performance indicators and measures to chart the performance of the department using real-time data in our primary indicator reports versus quarterly, biannual, or annual reports. We created an ongoing process of self-evaluation and strategy development at monthly TEAMS meetings, in addition to holding our managers accountable through a peer review process, which includes the entire executive management team. We recognized and rewarded those managers with accomplishments, and most importantly, we replaced those who failed to meet the department's new standards and goals and objectives. The results have been staggering. A 93% reductions in stabbings and slashings. In 1990, there were 165 in 1 month. Last month, there were 2. Uses of force involving physical injury, serious physical injury to staff or inmates or hospitalization has been decreased by 72%. Overtime dropped 44%. And if you want a notable comparison, in 1990, we admitted 125,000 inmates to the system, the same as the year 2000, the difference being in 1990 we spent $112 million in overtime. Last year we spent $49, a $61 million decrease. Sick abuse went from 21 days on average with staff to 13, a $1.6 million savings for every day saved. And on-time court delivery went from 67 to 90%. And today, morale is amongst the highest it's ever been in the agency amongst uniformed and civilian staff. And I'll turn it over to Debbie to talk about the enhancements of service delivery to inmates.
Clearly, the most important achievements of TEAMS has been the overtime reductions, the sick leave reductions, and obviously the violence. But there have been other operational improvements that have resulted from TEAMS. Employees come to work every day, and instead of responding to violence and dangerous incidents, they're working to improve services to inmates. And as a result, the programs to inmates have improved. The number of beds dedicated to our substance abuse treatment for inmates has increased to almost 1,500 beds this year from a low of about 200 in 1995. Through better screening and focus outreach, we've maintained less than 8% vacancy rate in those beds. More inmates are graduating from the department's residential drug treatment readiness programs, which prepare men and women for the community-based treatment programs upon release. That also includes a 50-bed program for mentally ill inmates. We work very closely also with the healthcare providers to make sure that there is enough doctors also to see inmates in a timely fashion. What TEAMS has demonstrated is that both order and high-quality services are obtainable simultaneously, especially in the largest jail system in the country. And in fact, they reinforce one another.
Thank you. Ed Dorn.
Commissioner, you mentioned some impressive outcomes, or someone did, with regard to the reduction in violence and reduction in overtime. But what you indicated you used to get there are, I guess, what would be considered fairly standard management methods. I'm interested in where the innovation lies here.
Well, really how you have to look at TEAMS is that it was a complete change in the culture of a uniform agency that was entrenched in maintaining the status quo. The beauty of TEAMS is its elegance and its simplicity. You assign accountability throughout the chain of command, from the commissioner all the way down to the correction officer.
So accountability is an innovation in the New York City correction system?
Assigning accountability and tracking the performance of every area of the department to make sure that the managers, that the uniformed staff, all the way from the top to the bottom, are using their resources wisely and efficiently.
This sounds strikingly like a program to which we gave an award a few years ago in New York City, but to bring the crime rate down, in which you were using a similar management approach, accountability coming from the police commissioner down. Yeah, CompStat.
Well, CompStat was the model we looked at initially to address violence issues in the system. We started looking at violence in our system like CompStat monitored and tracked crime. What we realized eventually was that if we expanded and broad-based our performance indicators and measures, we could really manage the entire agency by tracking those numbers and being proactive, and then, as Debbie said, holding the managers accountable. So really, instead of looking at just one primary indicator, like the police department looks at crime, we really started managing the entire agency, from violence, overtime, sick abuse, maintenance issues, educational programs, substance abuse issues. Everything was monitored and tracked through TEAMS.
David, and then Susan.
You talked about accountability. What kind of consequences are there for performance? That is, rewards for managers and teams of employees who are producing the results you want, intervention to help units improve their performance, and if they can't do that, some kind of negative consequence. Is that part of the system?
Well, the managers had to be held accountable, and I think, as Debbie mentioned, that was one of the biggest culture changes. Getting them to understand the culture of analysis, of accurate analysis, accurate data collection, real-time data, and then holding them accountable for the numbers. Initially, we had some problems, as did CompStat, I think, early on, with discrepancies in numbers. The managers today in the New York City Department of Correction, in fact, the entire executive team of correction today has come through this process. Those that understood the process, those that achieved accomplishments and success were rewarded by promotion. Those that didn't had to leave.
Let me just add to that. I also, part of my job is to run the Correction Academy for the 13,000 employees of the Department of Correction. And what we decided to do was, many of these people didn't sign on 20 years ago to be managers, and well, I shouldn't say managers, but statisticians and analysts. And what we've done is we've added a whole series of training programs for from everybody, from the time you enter the Correction Academy as a recruit, all the way through being a deputy warden and a warden. You're going through Leadership Institute programs in such areas as presentation skills, statistics, comparative analysis, and so forth. So not only are they learning at every Teams meeting what's expected, but they're also learning at the academy through these various training programs, how to do the job.
Susan Schwab.
You've answered part of my question, because obviously you are tracking a significant number of performance measures, lots of indices here. And the training is clearly a significant contribution to making that work. Do you still get complaints about the burden of collecting all that data?
No, not now, we don't. I think the culture has changed completely. When we started tracking the indicators, I think initially we started looking at 60 different performance indicators. As of today in the department, there's 183 different indicators that we look at, and everybody understands it's just a part of the culture.
These indicators, I want to also add that what the managers are looking at, or what the supervisors, the executive staff are looking at, are the 183 the commissioner just mentioned, which is a small subset of the 570 that are collected on a daily basis by tour by every facility in the department. What's happened with the culture change is that the managers, the wardens of the facilities, the chiefs, all look at this data as a management tool. It's not really looked at as a cumbersome pain in the neck, collecting statistics just for collecting statistics' sake. They're looking at it in a way to manage their jail, to make personnel decisions, and so forth.
Final question from David Osborne.
Is this the first time, to your knowledge, that a corrections facility has used this kind of performance management system?
To our knowledge, it is, and we've been in contact with the National Institute of Justice and Correction, who basically have looked at it. A number of other agencies, the New Jersey State Department of Correction, Hawaii, the Criminal Justice Division there, Broward County, a number of agencies have replicated it, but this is the first time it's been used in this system, in a correction system.
Deborah Kurtz, Commissioner Carrick, we thank you both very much.